Fancy cars, a big house, and lavish parties with groups of semi-strangers are just a few things people would list for the top reasons for filing bankruptcy. However, according to a study by MSNBC, 54.5% of the 1.46 million bankruptcies in the U.S. are due to medical bills. Even more shocking, a Harvard University study shows that 56% of filers owned a home and attended college. 4 out of 10 insured Americans cannot depend on their current health plan to cover them in a medical emergency. The U.S. Census Bureau estimates that nearly 47 million Americans do not have any health care insurance at all. That is 1 out of 7 people in the U.S., or 16% of the population. Health care is an issue that affects everyone, regardless of political affiliation or income level. The current system is broken and needs to be fixed. The working middle class must adopt a hybrid universal health care system that retains a choice and still covers basic medical needs. Comparing our current system to one that incorporates a universal health care illustrates the benefit of changing our current system. First, let's look at our current health care system. Many feel universal health care would only benefit the poor and uninsured. However, working middle class families that are currently insured need universal coverage more than anyone. They fall into a category known as the underinsured. Even though they have medical insurance, it does not cover their medical bills. I've personally fallen into this category. Even though I had self-employment insurance, when my child was diagnosed with type 1 diabetes, my insurance would not cover his insulin, needles, or other medical supplies. I was paying more than $1,000 in premiums and then $1,100 more just to keep my child alive for his prescriptions. According to Consumer Reports, currently 29% of Americans are underinsured. Their average median income is slightly below $60,000. 43% not only cannot afford medical treatment, but also put off regular doctor visits due to rising premiums and co-payments. 28% put off filling their prescriptions. Many are in debt for major medical procedures not covered by their health plans and are using retirement funds to pay for it. These rising medical costs are beginning to have bigger consequences. Again, an MSNBC study shows that medical costs were the reason for 54.5% of the 1.46 million bankruptcies filed in 2001. A Journal Health Affairs study shows that 2 million Americans a year are affected by bankruptcies due to medical bills. Reasons range from high insurance premiums and co-payments, as well as things not covered by their health plans, such as physical therapy and high prescription costs. Most had insurance, but lost coverage prior to filing bankruptcy. Many also lost their jobs due to illness, further compounding the problem. Average medical bills totaled more than $13,000 over what the insurance covered. Some bills, such as those with cancer, were more than $18,000 beyond their coverage. This is leading to using retirement funds, credit card debt, or borrowing money before filing for bankruptcy. Clearly, our current system is hitting the working middle class the hardest. In addition to believing that universal health care only benefits the poor and uninsured, many think that universal health care would be too expensive. Our current health care system has many hidden costs. The United States already pays 40% more with our current health care than nations with universal health care. Taxpayers and the insured are already paying for the uninsured. According to the National Center for Health Statistics, non-urgent cases account for more than 50% of the 90 million visits to the emergency room in the U.S. The uninsured put off preventive care, so when they finally receive care, they're in critical condition and their treatment is more costly. The cost of these visits is passed on to taxpayers and the insured through raised premiums. Before talking about universal health care, I'd like to dispel a few myths. Many people do not have accurate understanding of the differences between private and universal health care. Myth number 1, our healthcare system is the best in the world. Yes, we do have the best medical professionals in the world. However, we rank 20th or worse in infant mortality rates, life expectancy, and immunizations. Myth number 2, universal health care restricts access to care. Our current health care system, 47% of Americans have absolutely no access to health care. This is due to high costs of premiums or jobs that do not even offer health care. Myth number 3, private insurance would be more efficient. Our current system uses 20 to 30% of the premiums for administrative costs. In many cases, we still use old paper systems instead of digital records. There are many mistakes and slow processing due to this system. The biggest myth is number 4. Universal health care would lead to death panels deciding who gets care. The 2013 Blue Cross and Blue Shield Plan for Ohio and the 2013 Kaiser Foundation Health Plan for Ohio outlined there are already death panels and private insurance made of non-medical professionals. These panels decide which procedures are covered by the insurance premiums. Appeals can take over 6 months regardless of the illness that the patient is suffering. Decisions on coverage are based on financial costs of the insurer as well as medical need. With the rise in healthcare costs and the desperate situation of the working middle class that is underinsured, Europe offers an alternative with several approaches to universal health care. Europe offers a model for both failure and success. Sweden offers a warning for single-payer options. The government puts caps on how much insurers can charge a patient for out-of-pocket costs. The government then subsidizes the remaining medical bill. Rising medical costs have strained the government budget and led to a rationing of healthcare services to curb costs. Increased volume of patients and a lack of enough doctors led to long waiting lists, sometimes causing people their lives. An article in Business Week discussed how France has a hybrid system that has produced positive results. They instituted a universal health care that covers basic medical needs for citizens. The big difference from traditional universal health care plans is that people can still purchase private insurance to cover other medical needs. They retain the right to choose their own doctor if they can afford to do so. While it's easy to see pitfalls of our current system, how can universal health care reduce our costs? First, universal health care cuts down on bureaucracy. The U.S. uses 30% of medical costs on administration, while a country like Taiwan only uses 2% on administrative costs. A single-payer aspect would cut down the number of accountants, billing clerks, compliance monitors, and other middlemen that do not contribute to patient care. Second, changing from the current paper system to a digital system would save over $75 billion per year. These costs are for medical errors and waste of time of both patients and medical professionals on paperwork instead of actual health care. Lastly, universal health care makes it easier for people to get regular checkups. This prevents small problems from developing into costly critical care conditions. Preventive care is not only cheaper, it's covered under the most current insurance plans. However, catastrophic care is only covered to a certain dollar amount. After that cap is reached, patients are required to pay out of pocket for any additional costs. Universal health care will not only help the poor and uninsured, but help the working middle class that is critically underinsured. A hybrid system will get health care to all, but still allow those that can afford it to purchase private plans. This will maintain the positives of our current system while embracing much needed improvements. Our current system is set up to only help those that are healthy. If you get sick, the system rapidly begins to break down. It replaces the security of medical coverage with the back-breaking burden of medical debt. We cannot legislate behavior to force people to live healthier. However, we can make sure that everyone has coverage. Preventive care will help prevent the need for more expensive critical care and help rein in the rapidly growing medical premiums. It's up to everyone here to contact your national and local representatives to tell them we need a new healthcare system. This new system must not only offer universal health care, but also retain a choice in health care for those that can afford to pay for it. Do not get caught choosing between paying your mortgage or paying for your own and your family's lives.